Time for the first CMC joint.
I'm going to show you how to scan the CMC joint of the thumb. So the patient position is usually supine with the hand in a little bit of, almost with the thumb pointing at the ceiling. It's neither supinated nor pronated. The landmark is going to be along the shaft of that first metacarpal, and the movements are going to be very slight, gentle movements of the probe towards the palm or towards the dorsum of the hand until we very clearly see the sharp metacarpal and carpal adjacent it. Now, the area of interest is where this metacarpal drops off. It's quite a steep angle. So that's how we scan for the CMC joint.
Okay, now time to draw it. So what do we see? Well, we know that this metacarpal is bone, so there, and this is a normal shelf, that little shelf there. We know this is the carpal adjacent it. So what do we see? Well, we see some cartilage. Let's undo that one. There is articular cartilage, and there's articular cartilage here, even though we can't see it super well. Well, we know between bones is joint fluid. So there's fluid. What connects bone to bone is ligament. So essentially there's ligamentous tissue there. Tendon, we do see a slip of tendon a little bit up here, and that goes down there. And muscle, there's no real muscle in view here. So we're going to clear that away. We're going to draw it one more time. So bone, bone, cartilage, cartilage. We see, sorry, let's get that back. There's bone, bone, cartilage, cartilage. Joint fluid is in here. What connects bone to bone is ligament. There we go. Tendon, we see tiny slip of tendon just there. And there's no muscle. So let's see what it looks like in a live model now.
Going to show you how to scan and inject the CMC joint of the thumb. I usually like to have my patient supine, however some practitioners prefer the patient seated. Either way, your landmark is going to be the first metacarpal. We now have that in view. Your orientation is long on the metacarpal, and your movements are going to be proximal until the end of the metacarpal. We now see the area of interest highlighted with the yellow arrow. In this particular patient, we see the radial artery sitting just here. I can probably do the injection quite safely with a steady hand with my angle of entry like so. However, to be more safe, I could make a slight modification by supinating the hand, going back to basics, long on the metacarpal. My movement is going to be to the end of the metacarpal. And now, once again, you can see the area of interest right where the yellow arrow is. With a bit of passive extension, you can see the metacarpal, the CMC joint space open up. My angle of entry of the needle is like this. So those are two different approaches to do the CMC joint injection.
Excellent. Now time for the CMC joint quiz. Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.